telling me it was a little over 15 years from that journey leading you into establishing Cyber Clinic. Is that right?
Yeah, that's right. Yeah. So I've been practicing now for over 15 years as a clinical forensic psychologist, and I think one of the main sort of motivations behind Cyber Clinic was really the constant complaints that we were getting, as you would probably know, in the mental health care industry, which was really around navigating the mental health care system and finding the right fit practitioner. Right, and so that's really what sort of brought about the design of Cyber Clinic, because I was really looking for a way to develop a system around how patients could find the right fit practitioner and get the best possible outcome, because we know that therapeutic alliance really increases outcome. And so when I started on that journey, what happened was we started to look at sort of different products, what we could sort of utilize. And one of the things that we found is that there was nothing really out there from a technological point of view that could seamlessly integrate into the clinical workflow of my practice. So this was at the time PsyLegal, which is my bricks and mortar practice, and I was trying to integrate that into PsyLegal, and we couldn't really find anything. There was really no technology. And so, that set about me looking at what we could develop and working out whether there was a way that we could improve the patient experience and get them engaged and connected to practitioners that kind of were most suitable for them. And so that's when we developed the app. So the Cyber Clinic app was developed really to address that particular pain point of patients. But what happened is when we started to do that and we developed the prototype and we sort of released it, what we found is that it actually becomes, from a practice point of view, it actually became really quite cost prohibitive. And because what technology is moving at such a rapid speed. There's exponential growth in technology now. And the costs associated with that technology, with keeping up to date, having an entire tech team to really keep up to date with everything that's happening, with all the development that needs to take place, the securities, et cetera. So having that entire team in place becomes really cost prohibitive for small group practices and sole practitioners to a large extent. And so what we then did was we started to shift our focus to the pain points associated with practitioners, because we looked at that sort of model and we said, well, we could probably release it to other practitioners, other clinics, because that would solve a problem from a cost point of view for them to actually go out and have to develop their own teams internally in-house. And so that's how we developed the model to suit practitioners. And so when we released that out to practitioners, some of the real sort of pain points associated with practitioners is referrals, getting referrals. And what, as a practitioner, what you want to do is you don't want to lock yourself into one particular revenue stream. So the idea is to, develop a number of different revenue streams, which is what we have done on the platform, from a B2B model, partnerships with other, corporates, organizations, and also in a B2C model, going directly out to the consumer. So that was, the referrals was one sort of, pain point that, obviously practitioners have. The other is also associated with just the admin tasks, with everything that you have to do, right? I mean, if you sort of in a sole practice or a small group practice, there are sort of your admin costs are, pretty high. And what we were looking at doing was how we could use technology to actually reduce that particular cost as well. And so we have automated a lot of the systems on the platform, which then prevents dropouts, increases the retention rates of patients, reminders, those kinds of things. So that has been really beneficial for practitioners. And then of course advertising costs. I mean, for sole practitioners, group practices, advertising costs are really high. If you're looking at sort of Google and getting out there, we now know that a lot of the the ways in which you need to kind of reach your client base is through social media and online, and those present really significant costs as well. So that was another sort of modality in which we started to integrate that and develop a huge presence socially and online, and of course then the costs associated with just practice itself. Like if you're working in a GP practice, there's the commissions that you have to pay, really large commissions to GPs, and so those costs are all brought down through the CyberClinic platform. And so I think from a practitioner point of view, it really addresses a number of different areas in which they can benefit with reduced costs and admin and the like on the platform.
Yeah, I relate to what you've built there as, in a sense, creating a digital health program where, or a digital mental health program, in a sense where you are able to align it and target it towards certain communities or certain members of the community, and then create that whole journey that makes it easier for people to take the step towards mental health care support and accessing mental health care. And by delivering it via the mobile application, you're effectively embedding yourself into that universal smart tech device that pretty much the majority of the population has. So it makes it a lot easier for Australians to be able to say, okay, how do I start this process? How do I initiate this journey? And they're coming into the process, and I think that's kind of an understated part of your business model. It was a big part of why I've wanted to work with you on this, because that whole referral dilemma on the other side is definitely, I think, more of a universal kind of phenomena, and it always boggles my mind how much healthcare providers, mental health as well as the rest of allied health, spend on advertising to develop relationships with clients or acquire clients. And when you think about the statistics in Australia, it's pretty clear that there's a great deal of demand for mental health care. Demand is not the problem. It seems to be that the problem is really access, lowering the barriers to entry, supporting that orchestration dilemma. If the only way that people can come into access mental health is via a Google search, then you'd invest everything in that. But that's not the only way it works. There's the GP pathway. There's other points of care. There's that self-referral kind of process that happens as well. There's working with primary healthcare networks. There's a variety of ways that are developing and unfolding around how we actually get access to mental health care. And I think what's really important in your model is that you've programized it. You've made it really simple and easy in the smart tech context for somebody to be able to say, okay, I'm going to initiate the next part of the journey here.